to your Pelvic Health Podcast. My name is Susan Winograd. I'm the owner and founder of Pelvicore Rehab, and I am thrilled to be your host today. Thank you so much for joining me. I have a really special guest today. I've spent quite a bit of time with her in the last couple of months. Trista Zinn is here with me today. She is the founder of Corset Fitness, and she really has revolutionized hypopressive fitness. I have taken her courses, level 1, 2, and 3, and I will shortly be working toward my certification. And at the end of level 3, I thanked Trista for being my mentor. And she's like, oh, well, thank you. And I really have to say that I consider someone a mentor when they change the way I practice. And Trista has changed the way I practice. So she will forever be a mentor of mine. Trista, welcome.
Thank you. Thank you for having me.
I'm so excited. When I was going to launch this podcast, Trista Zinn kept coming into my mind. I'm like, we got to have her on. So thank you so much for being so open and willing and sharing your time with me to have you on. Trista, there's so much to talk about, but one of the things that I would love for you to share is your personal story and journey, because I think that, and I always say this, I think that's what people want to hear. People want to feel connected to someone else's story because it makes them feel like they're not alone, and particularly success stories, because there aren't enough of the success stories that people share out there. So Trista, could you share your story with us if you'd be so kind?
Of course. I'll try to sum it up a little bit in a nutshell if I can.
It's a great story. Take it away.
Okay. Well, first, I will let you know that I am a mother of 2. So I think that's important to know that I have a 22-year-old daughter and a 16-year-old son. And I'm in the fitness industry. So I've been in the fitness industry as a personal trainer for over 30 years now. However, back in 2012, I streamlined my business to only teach this hypopressive technique. So if I take you back to 2012, I was 42 at the time, and I had just completed a pelvic floor Pilates course.
Right. So you were, I don't mean to interject, but you were not a new mom. This story that you're about to say, wasn't once you're postpartum, you're always postpartum, but it was not an immediately postpartum story. You had relatively older children at the time.
Yeah. And, which is important to know, because I think, and as I share my story a little bit, my diagnosis for me was a little bit more of a surprise, because I don't know, maybe it would have been something I could have expected to hear being a new mom, but not being a new mom and my kids being 12 and 6 was like, I think it became, well, as a shock as it can to many, but for me, that was one also thing that hit me. And so, it was at this pelvic floor Pilates course where I had heard about pelvic organ prolapse for the first time. I never even heard of it before. I had actually never even heard of pelvic floor physiotherapist before. And I was 42, like I said, a mother of 2 in the fitness industry, kind of thinking I knew everything that I needed to know about health, fitness, maintaining my core health, etc., with what I was doing. And going into this course, and I didn't have any signs or symptoms of incontinence after my kids or prior. And I didn't think I'd had any signs and symptoms of pelvic organ prolapse either, although I wasn't as aware of what pelvic organ prolapse was and as in tune to what signs and symptoms pelvic floor dysfunction can display. Mm-hmm. So learning about a pelvic health physiotherapist, I started telling all my clients and all my friends, we should go see a pelvic health physio, even if it's to get a base mark, to find out, okay, where we're at for preventative reasons, if anything. And it was, so I booked my assessment with the pelvic health physio. And it was at that assessment that I actually found out I had stage 2 bladder prolapse. So I had a cystocele. And although going into that appointment, the symptoms that I had that I now believe were symptoms of pelvic floor dysfunction were chronic piriformis issues ever since the birth of my eldest, my daughter. And I always had like a little bit of not always, but it came to be that every so often I had sort of like a tugging or a pulling sensation kind of high up the leg, like on my pelvic floor. And I just sort of thought, well, maybe I'd overdone it running or at the gym. I'd overdone adductors or something. But as my pelvic floor started to restore, I no longer had those symptoms at all. So that's why I believe that they were symptoms of what I was displaying, which was a stage 2 bladder prolapse. And so going into that appointment, although I didn't have, like I said, many symptoms, that piece of information that she gave me and leaving that appointment, I had every symptom. Like I became so hyper aware of my pelvic floor. It was all I could think about. Like I was worried about how I was standing, how I was breathing. I remember about to cross the street and thinking like, oh my God, I have to pay attention. I'm going to get hit by a car. Like I was really consumed by this piece of information and that part of my body and every sensation I was feeling. And
I hear that all the time. It's like you're not super symptomatic.
You.
Yeah. And then you get sort of like a diagnosis and then you have every symptom and it consumes you. And it could be very catastrophizing. We'll talk about that in a minute.
Yeah.
I want to finish your story, but I'm having these aha moments as you're talking that I want to share, but I want you to finish your story first.
Okay. And so the other thing at that appointment, it was really, I don't know what you say, but I'm a cyclist, a runner, a cross-country skier, strength training 5 days a week. I love everything outdoor fitness, and I train a lot. And so at that appointment back then in 2012, it's not offered suggested so much now, but I was told to stop doing all of those things, stop doing all of this because it could make the prolapse worse. So even if someone had just told me to stop doing all those things, I would have mentally had,
a breakdown.
Yeah, totally. Because all of those things I would have used to help me emotionally cope with this piece of information I was just given. And I was also told not to do that. And I remember my husband was away on a business trip at the time. It was actually Mother's Day. And I had the kids to myself. And I just wanted to be in my room by myself and just figure out what was going on. And they were driving me nuts. And then I didn't know, is this something I tell my husband or I don't tell my husband? Like, is this going to affect the intimacy of our relationship? And the other thing too was, it was just like, it was a piece of information I couldn't really share with my friends at the time. I mean, now I'm telling everybody, but back then it wasn't like I had a knee injury and I could kind of, complain about the fact I can't run because of my knee, but I'm doing something else. It wasn't easy to chat about, and I didn't know who to talk to about it.
Right. It's like you have to suffer silently. And that's so, you don't have to, but many women feel like that, which is why this conversation is so important. Go ahead.
Yeah, because you just don't really know what their reaction is going to be because they probably have never heard of it themselves. Right. And so anyway, I think you go through this emotional roller coaster, or I certainly went through this sort of emotional roller coaster, so to speak. I was really angry. I was really angry at my doctor. Like, why had no one ever told me about this? Because I'm someone who very much likes to practice things for preventative measures, right? So if I'd known about this, I would have done something, hopefully, or trained differently to prevent it. I was mad at the fitness industry because if all those activities I was told not to do because they could encourage this from getting worse, then what should I have been doing or shouldn't I have been doing that might have caused it in the first place? You know what I mean? Like These were things that were kind of going around in my mind. And then I remember being in bed with my son, reading him a book, and he'd fallen asleep and I was lying there and I'm like, okay, then you have to turn yourself around, turn the brain around. And I'm like, okay, kind of get a grip on this because it's not your kids. It's not terminal. It's, surgery wasn't sitting right with me. And that seemed to be one of the options that was kind of looming in my future with surgery. And I guess I kind of thought, you know what the hell? Like, I'm not letting this going to determine what I can't do for the rest of my life. Like, I got to freaking figure something out. And a friend of mine, Kim Bopney, who's also in the pelvic health industry, had just started hearing about this hypopressive technique. And so she had mentioned it, and I looked it up on YouTube. There wasn't anything in English at the time. It was all Spanish speaking. Mm-hmm. And I kind of did what I, recommend people not do today 100% because it can be done incorrectly, although it can be done correctly too. I kind of started to emulate what I saw on YouTube, and I don't speak Spanish. So I was kind of doing the best I could. And for some reason, I connected with it. I connected with the breath. Within 2 weeks, I went back to the pelvic health physio, and my stage 2 prolapse had gone up to a stage 1.
It's incredible.
And she couldn't believe it. Yeah, she's like, oh my God. And my pelvic floor function was starting to normalize, et cetera. I'd only had a small episiotomy of 3 stitches. So she'd worked a little bit of that scar tissue out, and it was even starting to move much better than it had the first session. And so that's when I was like, okay, oh my God. As a personal trainer, like, can I take the courses? It wasn't being offered anywhere in North America. Is there someone who's speaking English? Is there a course in English? And so they'd actually had only just entered the English speaking stream a week or 2 prior. The first English course had ever been taught. And so I contacted Kaisa, who's in Banyuls, Spain. She was the only English speaking instructor at the time, and she taught me privately. So I went to Banyuls, Spain, and learned the level 1 because I thought, you know what, even if there's a certain percentage of the population who would respond the way I'm responding, I kind of wanted to bring it here,
That's amazing.
I needed to, be able to offer this, and who knows where this was going to take me because it had gone from a stage 2 to a stage 1, but I wanted to continue practicing and see where this was going. And it was really starting to change things in my body. And so I saw her. She taught me privately the level 1. I learned the postures and the poses, the details, et cetera, and the concepts behind the technique. I came back, practiced it, started teaching it to my clients. And within roughly about 4 weeks, I'm going to say, because I wasn't writing a journal at the time, but roughly 4 weeks, I went back to the pelvic health physio and I no longer had a prolapse.
It's incredible.
And that kind of started my whirlwind journey back and forth to Spain, because how am I going to teach or help as many people as I can? I need to teach this to the professionals, the pelvic health physios, chiros, yoga instructors, Pilates instructors, fitness trainers, etc. So then they have this as a tool that they can offer their clients or their patients for preventative reasons or for restorative reasons. And this is what I do. I became a master trainer, a course instructor, and in 2012, just after I'd come back, I changed my whole fitness industry area of specialty to offer only hypopressive. And this is what I've been doing since then.
It truly is your mission, Trista. It is really part of who you are and what you were meant to do. It's so obvious to all of us that know you because of the way that you talk about it, because of the way that you teach it and the passion that you convey. And just the fact that you had this personal story and you went to Spain to bring it back to help other people is incredible, and really incredible, and it's inspiring. There's a couple of things about your story that I would just like to discuss or comment on. The first one,
of course,
is I hear this all the time. Why did not my doctor tell me? Why didn't anybody tell me? So, you had mentioned that you were mad at your doctor, and we educate, and this is why I'm doing my podcast, and this is why you're being a guest on my podcast, and we speak. But the difference in your story is that you were a fact finder and you advocated for yourself and you found other solutions. So we sort of have to take that anger and frustration and channel channel it in the right direction, which I think is so important to find out, because I do have clients who end up in that place, but they'll go to these chat rooms, which could be extremely catastrophizing. And it's very easy to fall into this trap of commiserating and being reactive rather than proactive. And you were proactive, which I love.
Yeah, and I agree with you with regards to the private pages and stuff. I think there's a place for it, and maybe there's a time for it at the beginning when you just need to share. And like I said, I didn't have a friend to share with, although at the time I don't think there was a private Facebook group or anything for this either. I don't know. So I think there's a time for that if need be, but I think there's a time you need to leave those groups actually, because as you mentioned, I mean, I've had clients who's they've gotten the success that they're looking for, they're symptom free, etc. And then they go into the chat again. And it's kind of like this is the example. It's like, wait, can you hear that noise? But you never heard the noise until someone pointed out the noise. Right. And then all you can hear is this noise.
Absolutely.
Right? It's the same thing. So someone will say, oh, I have this symptom or I feel this. And all of a sudden it's like, oh my God. Then they start feeling the same thing. Right. So I think I agree. There can be too much of that, and you have to break free of it, and you just have to.
What I always suggest, and I do have clients who want to feel a sense of community, and what I would encourage people to do is that if you do want that sense of community, which we know social interaction is so important for healing, but I would ask your pelvic health physio or physical therapist, depending if you're in Canada or the States, to find you a positive and productive group. I am always recommending positive, productive, and healing groups to my clients rather than going on these sort of catastrophizing groups.
100%.
I have a question that I'm so curious about, Trista. As you were telling your story and you went to the pelvic health physio, first of all, props to you and kudos to you that you were a personal trainer. You had learned about pelvic health physio, and then you started recommending it to your clients, which I wish everybody would do, because the truth is we doctors that recommend it are great, but as healthcare providers, we all have to be on the same page. But as a pelvic floor physical therapist, and I think I'm not speaking for myself, we kind of struggle with when clients come to us for whether it's an issue or just a checkup, and we do notice that there is a pelvic organ prolapse because of laxity in the vaginal wall, and no one's ever told them that they have a pelvic organ prolapse. Whether we should be the ones to use that diagnosis, if you will, or convey it in a different way. For example, like, I am noticing that there's a bit of laxity in your vaginal wall, and in order to keep your pelvic organs in their optimal and supported position, this is what we are going to do. Instead of saying you have a stage 2 pelvic organ prolapse, because that is a diagnosis, one of the most fear-inducing words that I find in my population. So as a community, we talk about just using words that are not pathologizing. How do you feel about
100%.
that? Because it changed 100%. Your life in a positive way. So I'm listening to you, and the fact that you got that diagnosis, which I don't love that word, but that someone said that to you, that led you down a path of healing and recovery and mission and passion. But yet, I don't know if I feel I should be the one to be giving that diagnosis to people in that way.
Okay, I agree. And although mine came from there, I definitely had it down before I went up. And if some people stick in that down for longer, then it's not a good thing. And it's not, like you say, it's not a move forward healing path. It's more of a catastrophizing, searching on the internet for something. The stage 2, I agree with you 100% in the fact that I would like the pelvic health physio. And just remember that my diagnosis was back in 2012. And I think the language is changing a lot since then. And there are a lot more pelvic health physios that are speaking the language that you just spoke.
Because words matter,
which is much more helpful. Words matter a lot. And they matter a lot to everybody in a different way, because everybody's perspective or perception of what you're saying is also different. And I think you have to also, you, me, those who work with clients or patients, we have to be mindful of who we're talking to. And we don't know where they're going to go with this information. And we need to take a certain approach and maybe a different approach for some people versus other people, perhaps, right. And definitely, like, if it'd been something like that, then it's like, it's not, then you're showing me things that I can do Correct. In a more preventative way, as opposed to, you have this is where you're headed, surgery, right? It's too much of a slap in the face.
Yeah, so I agree. Like, I was just curious as to how you felt about that. So I feel like
I agree.
Yeah.
But I think too, because I've also heard from some therapists where there's a little bit of discussion, and you can correct me if I'm wrong, where they're like, we shouldn't say that the person has a prolapse or not. We should just, and to me, I would want to know, or like you've said, that there's laxity, for prevention or whatever. These are the tools that you can use. I want to know that. I don't want to know that things are fine. I want to know that you need to do some preventative work.
Correct.
These are things that, because I want to prevent things from happening. And if I'm just kind of things are good, or there's a little bit of this, like, I might not do what I need to do with the same mindset, so to speak, as I would be if I was told that this can also happen. Do you know what I'm saying?
Absolutely.
Am I saying that correctly?
Yeah, absolutely. And I think the bottom line is that you have to understand the person that's sitting in front of you and meet them where they're at. And, you're a personal trainer, so you understand the body, you understand the language. I think ultimately you can even do it in stages. And once the person sees that there's hope for healing, this can be managed conservatively, then you can kind of use the word prolapse once they see that it's okay. I personally, with my clients, because I tend to see a bit more of a complex clientele, they've already been through so much. So I really try to avoid giving them further diagnoses if possible. Trista, I want to make sure that our clients,
I agree.
And thank you for sharing your story. I think that, and I've said this on the podcast before, we cannot take it for granted when people come on and share their personal stories, because it's not easy, but it's so important. So thank you for that. For our clients who don't really understand what hypopressive fitness is, could you explain it a bit? Because I want everybody to really understand what it is.
So Hypopressives originally was created to help women restore and prevent pelvic floor dysfunction. But over the years, it has become so much more than that. And it's offered to men and women for core restoration and maintenance. Okay, so it's a core restoration and maintenance program. And I think if we're going to talk about it and move further from this, I think let's acknowledge what the core is first.
Thank you.
And what it's responsible for. And so our core is made up of this respiratory diaphragm, the pelvic diaphragm or pelvic floor, the transverse abdominals, the deepest abdominal muscles, and the multifidus in the back. So this canister, if you will. Mm-hmm. And all those muscles are supposed to work synergistically as a unit. Without us thinking about them.
Reflexively.
And and in automatic sort of anticipatory way, right?
Yep.
As we move through our daily activities. And they're responsible for a lot. Like, a lot of people think core is abs, right? And the core is actually responsible for digestion, circulation, being able to project our voice. It's a support system for our pelvic organs, abdominal organs. It helps to balance and counterbalance pressures within that abdominal canister.
Mm-hmm. I think it even regulates our nervous system, right? The vagus nerve goes
100%.
right through the diaphragm, and the breath is so responsible for regulating nervous system. I mean, the deep core system
sexual function.
Correct. It's really what keeps us upright and functioning.
Exactly. And so if we're looking at that piece, that the core, Well, if all those muscles are supposed to work together then, right? Like this orchestra or whatever, that's everything's working together as a group or as a unit, then how do you train one muscle? Then you can't really train one muscle at a time. It's better if you can train them together as a group because that's how they function.
Right. Train the system.
You train the system to work as a unit, but also those muscles, like we mentioned, work in an automatic anticipatory way without us having to voluntarily contract and relax them or think about them. We want them to just respond as we go to pick something up, we cough, etc. So then again, you have to sit back and be like, okay, wait a minute. How do you treat a group or train a group of muscles that's supposed to work in an automatic anticipatory way without actually voluntarily contracting and relaxing them? Well, that's where the Hypopressives is unique because we have this unique breathing pattern or breathing technique that we use. But again, even to just use that breathing and sort of abdominal maneuver, then we're just looking again at the canister, but everything from head to toe to the fingertips also affects this canister's ability to function, right? And plays a role in the pelvic health, respiratory health, etc. So Hypopressive technique is a full body approach to core and pelvic health. And it's a series of postures and poses that we practice to give you a bit of a visual. It's not that dissimilar to a yoga per se.
Right.
So there's a series of postures and poses that are done statically when you're in the beginning level. And you couple this with this unique breathing technique. Now, the unique breathing technique, you get a decrease in pressure in the abdominal and pelvic cavity, and everything gets drawn inwards and upwards.
I love it.
So we, decongest the pelvic cavity. What we're also doing, which is so nice, is we're getting a deep release of myofascial tension. Right. And some like this deep internal massage.
Can you talk before I think this is so important, but I also, before we start talking about that, which is important, I want people to understand that it's a series of poses, yoga-esque in that there's a flow, but it's not like yoga, which I love that there's a flow to it. So people are not counting repetitions so much or doing the 2000 Kegels. There's like a flow, a practice to it. But the apnea part of it is an important part if you can do it, right? Because not everybody can do the apneas if you're pregnant. Can you just, before we talk about the myofascial release, can we talk about what an apnea is and how it's incorporated into the hypopressive flow?
Yeah. So the word apnea itself means to not breathe, right? And so with this exercise technique, we do typically the 3 rest breaths where you simply inhale and you exhale, right? While you're maintaining these specific postures and poses. And at the bottom of the 3rd and last exhale, we exhale. And when the air is out, we do not force all the air out or push it out. But you exhale to the point where just before you would go to need to take a breath, then you would close the nose and the mouth become inactive and you go to mimic taking a breath. You just don't allow any air in.
Right.
Whereby you open the rib cage. Yep. Just like you were when you were taking an inhalation, except for you're not drawing air in, which creates a vacuum effect and everything gets drawn inwards and upwards. And you hold that for what you can. You're holding your breath as you're fine-tuning the details of the pose and growing, and like you're trying to take more air. And when you need to take a breath, you simply open the airway and you allow the air to enter. And it should always be an inhalation at the end of the apnea, because if you exhale first, you're like, okay, wait a minute. I either snuck in air or I didn't get enough air out.
Right.
So you want that initial inhalation to release to be an inhale. And you hold it for what you can at the beginning comfortably. And that length of time can vary depending on the person.
Right. So
and it increases over time.
I want to clarify for people, because I think this is so important as pelvic floor physios, we tell people not to hold their breath because that increases pressure. But with hypopressives, it's done in a way where it's actually decreasing pressure. It creates a negative pressure. And I think it's important also to point out that we are initiating the apnea at the end of an exhalation, and that is part of the breath cycle that decreases intra-abdominal pressure, right? We're letting go of pressure, and then we do the apnea and it decreases pressure even more. Would you say that's correct, Trista?
Yeah, when we're doing that final exhale, we're getting that pelvic diaphragm, the pelvic floor, and that respiratory diaphragm to rise,
right,
on the exhale. So then when we go to mimic taking a breath, but we don't let any air in, and we go like this, then we're getting more of this decrease in pressure. And that's when everything gets drawn inwards and upwards even more. Right. From where it was before.
Right.
Yeah.
And I love the technique for so many people for two reasons. One, you just started to say that it gives you this internal myofascial release, which many people rely on us to do. Right? They rely on pelvic health physios to give them that internal myofascial release. And this is a great way to help people be more self-effective and independent. It gives you like this total body fascial release. So I love that. And I feel like it really empowers people to just strengthen their core in a different way.
Totally. And so the thing is that when, even with the pelvic health physio, although you might be internally, vaginally releasing tension, you're not like internal.
Correct.
Right. So this offers such a nice complement to what the pelvic health PTs do, because they can do the internal release, but then the person practices the hypopressives then on their own, and it can help maintain the results and carry those results a little bit deeper internally from what they are just able to receive at the physiotherapist or the massage therapist, who again is going from an external on the skin.
Correct.
But the hypopressives allows the body to do it on its own, and it helps it find those spots that need this release and tension and bring about a better balance.
Right. This is a really good segue for you to talk about how hypopressives are different than Kegels, because Kegels are an active recruitment, and I think hypopressives work so much more naturally with the mechanics of the deep core system. Can you speak to that a little bit?
Sure. So yeah, hypopressives, definitely different than a Kegel. The Kegel, where you're using your mind to voluntarily contract and relax these muscles, probably targeting more of the type 2 muscle fibers, I would say, as opposed to the type 1 muscle fibers, the ones that are the postural and respiratory muscle fibers. And those type 1 muscle fibers are found predominantly within the core and the pelvic floor by like 69 to 70% predominant, whereas there's roughly about 2 to 3% of the type 2. Now, the type 2 muscle fibers, to give you a bit of an example, you'd find a lot of them in the quads, the glutes, the biceps, etc., where the type 1 is found more within the core. They're not as quick to fatigue. Where like a quad, you do so many squats, you're going to fatigue. But we want the type 1 core to be like, functioning, supporting, doing what we need to do all the time without us thinking about it.
Correct.
So hypopressives, we don't claim to strengthen the pelvic floor. We're improving the function and the support system of the pelvic floor and the core as a whole. And so what happens, and how it's unique from the Kegels, is one thing is, it's happening automatically. What happens in the pelvic floor is happening automatically because of this apnea and this expansion of the rib cage. Everything gets drawn inwards and upwards, and this type 1 muscle fibers becomes active. Yep. And when you see on the ultrasound, you'll see this activity happening in the vagina or the vaginal canal, but then you're also getting a vacuum effect from the top. So it's kind of from the top, you're getting a vacuum. You see the bladder lifting from the top, but you're also seeing that it's improving that support system from below. And it's really nice again, and offers a nice complement to the pelvic health physio work, because here's an example to help wrap your mind around what I'm talking about too, is the pelvic health physio could say, okay, can you do an active contraction for me, or voluntary contraction? You maybe offer feedback with the fingers or whatever to try to get them to create this a contraction. And the woman's like, okay, I hear what you're telling me. I know what you want me to do, but they just can't make it happen, you know?
It's like shocking to people how disconnected they are, and that, you know, they don't have that proprioception or that connection to their pelvic floor to actively engage.
For sure. And so then yourself as a hypopressive trainer, you're like, okay, let's work with some hypopressives, and you have them practice hypopressives for whatever period of time. And while you're doing hypopressives, you feel the pelvic floor go up automatically, right? It's like, oh, and they're like, oh, that's the move. Oh, there's the muscle. Oh, that's the direction things are supposed to go in. And it starts to create this neurological loop, right? Where then the brain is more attuned to those muscles that have been working in this automatic, right? Or automatic reaction. And so then you go back to the pelvic health physio, and she's like, okay, well, I know you've been practicing hypopressives for a little while. Let's see what your contraction is like now. If you can voluntarily contract and turn on more of those type 2. And she's like, oh my God, now I know what you want me to do. And now she's able to better offer a better voluntary contraction or activation of the pelvic floor, because she started to make that connection. Right. Where there was a disconnect before.
Yeah. So it's almost like a biofeedback that you can do with yourself. But at the same time, it's training that reflexivity, that automaticity, which is, so, I mean, it's what our deep core system is based on, right?
Yeah. And then the other thing that, if I might say, is a little brilliant to the hypopressives compared to the Kegel, because the Kegel or the Kegel or pelvic floor, if you don't use the term Kegel, it's fine. It seems to be still kicking around a little bit. But the pelvic floor contraction or active contraction, what's different again with the hypopressives is because that doesn't actually bring the organs up and reposition. With the hypopressives does do that. So the hypopressives, you also get this decongestion of the pelvic floor, right, of the pelvic cavity, and repositions and draw the organs up. Yeah. So again, when there's that less pressure in the pelvic floor and on that those muscles, it's maybe also easier to contract, right, and create this lift. So and with hypopressives here too, and I think this is also very important, because it's not just about the results that you get at that moment in time, right? Where things decongest and draw inwards and upwards. If we're taking a look at the full body and we're looking at the details with all the postures and the poses, and we're starting to line up those domes, the respiratory diaphragm is like a dome, the pelvic floor is like a dome. I call the top of the head is also a dome shape, how I like to cue it. But if these domes are starting to line up, and we're starting to now activate and bring on more of those type 1 muscle fibers, internal support system, we're allowing ourselves to better manage increases in pressure. Yes. Right? For the activities that we love to do. And again, that's something different than just practicing an active pelvic floor contraction. It's different than actively saying, okay, can you contract transverse abdominals and the pelvic floor at the same time? Because those are all fine and good, and they can offer you what you need. But a lot of times I hear people say, it feels like hypopressives is just that missing piece. That missing piece, the bigger picture perspective where this did what it needed to do. But now we have something, let's pull it all together. Let's offer our body the ability to manage these pressures and support us and have that functional movement where we can relax and contract as needed, right?
Absolutely. So one of the things that I'm proud of is that we treat using a whole body approach, which Hypopressives is, but just, and Kegels have a place, active contractions have a place, but I've never met a client who enjoys doing active pelvic floor contractions or Kegels. It's boring, right? Yes, so this it's boring. And I truly believe that in order for a client to be compliant and have adherence to the program, it has to be something they enjoy, something that brings them joy. And I truly believe that Hypopressives could do that. And that is one of the reasons that I love it so much. 2 more questions, Trista. We're talking a lot about pelvic organ prolapse. Can you tell us I know there's a plethora of other things hypopressives can help with that we haven't discussed. So let's just touch upon a bunch of them because hypopressives could be good for everybody. So let's talk about the other things. I'll let you take it away.
Sure. So hypopressives is great for those with incontinence to prevent incontinence and also help restore. So you're not living with incontinence. It's great for even for sexual function for men and for women. For men, it helps to relieve pressure that's on the prostate, and especially as you age. You don't want to have a lot of extra weight and pressure on the prostate, so it's good for that as well, just to tap into some men's issues, and also help release tension with the pelvic floor there as well. So a lot of times people think that hypopressives is just to strengthen the pelvic floor. But like I said, we're not strengthening the pelvic floor. We're improving the function of it. And if we're looking at function, we're looking at the ability to be able to release and contract. Yeah, or lengthen the muscle and then shorten the muscle. So hypopressives does that as well beautifully. It works also. Oh, you can get better orgasms if you're practicing hypopressives because it's improving the blood flow, the circulation, making you more in tune proprioceptively with those muscles. It can help
with constipation.
Women in menopause.
Yeah,
constipation. It can increase lubrication.
Yes,
for menopausal women or postmenopausal women. Again, why is that? Oh, we're getting circulation movement there, digestion. Yes. Right? We're getting a really nice internal massage of the organs. You mentioned earlier about the nervous system. It offers such a nice balance to the nervous system. There's a very mindfulness component to it, although there is it's more stimulating than a rest and digest, so to speak. But there is very much a mindfulness component to it because you're focusing on the breath and we're balancing out the inhales and the exhales are longer at the beginning. So we're tapping into that parasympathetic nervous system. We're teaching people how to exhale. Oh, so they can get a really nice inhale. So we're improving sports performance. We're going to improve like mobility, fluidity of movement because, to visually look at the poses online or to look at this, what the technique looks like, a lot of times people think we're, isometrically holding these poses with tension, but we're not. We're more eccentrically lengthening, creating space, right? And we're looking at it, the neurology. Yep.
And that's why I feel it's really important. Thank you for that. I feel it's really, and I really feel it's important. And when I embarked on my own hypopressives journey, I did not look online for instruction. And I feel like many people think they could watch YouTube videos and sort of emulate it like you did. You were fortunate, but it is technique specific. You need good rib mobility. You need good coordination. You need to have a good foundation for breath and mobility and coordination
100%.
To start out with. So I really hope everybody listening to this will not just go online and look at hypopressives because it is possible that if you're not doing it correctly and you're not taught correctly or cued correctly, you can end up increasing intra-abdominal pressure, which is not what we want. So find a trainer to help you, get set up for success.
For sure. And then I'll just, if I can kind of build off of what you just said there also, which is a great point. It reminds me, as you know, from taking the courses and seeing me personally or like privately, there's a lot that we do with the breath work before I even introduce the apneas, that false breath, right? There's a lot of breathing patterns that are not so optimal. And if they're going into this technique and they're going to keep mimicking the breathing pattern that they already have, where it's upper chest or too much in the stomach or too much of a exertion on the exhale, and they're doing that for every 3 rest breaths, and then they're going to try to mimic taking a breath incorrectly or not optimally, possibly, as they were before, where it's all upper here or the rib cage not moving, then they're not really going to reap the rewards that they're looking for. And I think really it doesn't matter what you're doing. If you're seeing a trainer or someone can give you that personal perspective, you're going to make gains more than you will if you just try to practice it yourself.
Absolutely.
So to have the eyes on with it, whatever you're doing, you're going to be able to reach your goals more effectively. And if you're not, then maybe you need to fine tune the details and see someone. And yeah,
absolutely. And full disclosure, hypopressives did not come so naturally to myself, which I was shocked about. And I am, doing private sessions with Trista to improve my own practice. So, doing it, if you're going to put the effort into doing it, make sure that you're doing it correctly and optimally. Trista, I could talk to you all day long, and I'm going to have you on another time. Can you give our listeners a takeaway to close with, pearls of wisdom that you would like to communicate to our listeners?
Yeah, sure. So I think my pearls of wisdom are really to be patient. Be patient, because if you're patient, then you're going to be able to navigate this journey a little bit better than if you're not patient with yourself and you're desperately trying to fix it and make things happen. You're not going to be in tune to what's out there. And other techniques too, like there are other techniques that work really nicely for people, and hypopressives happen to be my miracle, and it's working brilliantly for thousands. But see which one really resonates with you and patiently embark on this journey. Be kind to yourself. I like to tell people, we're so hard on ourselves, but if we could offer ourselves the same kind, supportive words that we would offer a dear friend going through the same thing, and not be so hard on ourselves for not doing it right or not having it or whatever, but offer yourself the support and this gentle guidance. And then you can move forward instead of, I think, getting sort of stuck in a rut, then you're able to pause.
I love that.
And okay, what is there? Where can I go? Where, and I had to talk myself. I say positive self-talk. I don't know if that's the right way to say it, but every single time something negative would come into my mind, I had to flip it. No, you got this. You got this. You can do this. Don't think of the things you can't do or shouldn't be doing, or you don't feel good doing. Think of all the things you still can do.
Your brain believes the story you tell it. Yeah.
Totally.
Yes.
And there's so many precious moments in time that can be lost because you're so hyper-focused on your pelvic floor. Yeah. And I think if you can let go of that a little bit too, and okay, how am I breathing? How am I standing? Enjoy and see what's around you. Then you'll be able to move through this journey with more ease.
Trista, and, you are the best. You're brilliant. Thank you. Thank you for coming on. I really, really appreciate it. We're going to have you back because I feel like I could have spent more time exploring and discovering, but thank you for your time. I know everybody is going to want more of Trista. So you can find Trista on Instagram at hypopressives.canada. You can find her on the web at coursetfitness.com. You can find her at hypopressivescanada.com, on Facebook and on YouTube. We're going to put all of the links in our show notes. So please look out for them to see where you can find more of Trista. She's an absolute wealth of brilliant knowledge. Please look into all of her links and resources. Thank you, Trista. I hope you've all enjoyed this episode of Your Pelvic Health Podcast, where we give you the real lowdown on pelvic health matters. Please reach out to us at pelvicorerehab.com. You could find us on Apple, Spotify, or wherever you enjoy listening to your podcasts. And remember to follow, and give us a 5-star review. That is what allows us to keep bringing you more of what you want to hear. Always keep in mind that you should be your own best advocate and that pelvic healing requires a total body approach.